Welcome back. October is Breast Cancer Awareness Month, and there's been a lot of research on the effects of hormone therapy on the risk of breast cancer. And today we welcome Michael Betts, founder and managing partner of Abundant Living Medical Clinic, with a look at some of those findings. Thank you for being with us.
Absolutely. Always a pleasure.
Well, we, of course, this time of year in October talk about breast health, and a lot of women want to know about their options when it comes to lowering the risk for breast cancer. And there's a lot of studies that have focused on progesterone and specifically. What are you seeing with that?
Well, I think one of the biggest things that we see is there's just a lot of misinformation about hormones and can hormones cause cancer. Unopposed estrogen is not something that will cause cancer, but cancer can feed off of that. So in other words, if your hormones are screwed up, you can actually create a breeding ground that if you have hereditary issues or environmental issues, that cancer can thrive in. So birth control is, most women have been on that. It will affect your production of natural progesterone. So unopposed estrogen is the problem. So if you have your progesterone levels where they need to be, then that helps everything, because basically your estrogen likes to sit in your breast tissues and your uterus. If you've had a hysterectomy, then it likes to sit in the breast tissues. If it's unopposed, it can cause problems and create a breeding ground for cancer to thrive in. So it's interesting how it is, but it's really just a matter of, if you can get your body what it needs, you can be very preventative in allowing something like that to happen.
And what's important to point out, I know you have some stats about how many women have low levels of some hormones or things that aren't at the levels they should be.
Yeah, probably. I can't remember it off the top of my head because I looked it up for you before but I think it's about like 890 women that we have seen. 98% of them have all come in with low progesterone, and I think 60% of them have been less than 0.05%, and we have all of our women between 10 and 15. So if you think about that, less than 0.5%, more than 60% of the women, and we put them up between 10 and 15.
And how does that process work as far as finding out what your levels are and what kind of therapy options you have?
Everything is based upon your blood. And obviously this is something we test for every day with all the people that come in. But just in kind of an honor of this, and to help women take a look at it, this month we're just offering for $50 if they want to come in. We'll pull a blood test for them for their progesterone and just talk to them and help them to understand what's going on. It is such an important thing for them to make sure. And then on the same level, too, it helps regulate periods. It's your beauty hormone for skin and hair, and it's one of the most important things you need for good sleep.
I haven't heard that before, the beauty hormone.
That's it.
I like that.
That's it.
It's my beauty hormone. Well, you see there at the bottom of your screen the phone number and website for Abundant Living Medical Clinic if you're interested in learning more and taking advantage of that $50 special they have going on this month. And one location right now, but that's about to change.
It's exciting. We are going to open up our second location in the Beaumont Center. It'll actually become our corporate headquarters, 3,700 square feet, just a beautiful facility. And we are growing and have hundreds of patients, and they're telling their friends, and it's very, very exciting times.
Well, thank you for being with us again. You see the website and phone number for more information, and we'll keep you posted on that second location, and we'll check in monthly with more information and health news from Abundant Living Medical. Thanks for being with us.
Thanks, girl.
We'll be right back with more news and weather after this.